And it's just a huge honor for me today to be podcast interviewing Dr. Dustin Mullens, a dermatologist. He's with Affiliated Dermatology. He began his residency training at Affiliated Dermatology in July of 2016. He received his undergraduate degree in biology from Coastal Carolina University in Conway, South Carolina. Dr. Mullens received his doctorate degree from Edward Via College of Osteopathic Medicine, Carolina campus. Following graduation, he completed his internship training at Ohio Health, Blessness Hospital in Athens, Ohio. His professional membership included American Osteopathic College of Dermatology and Sigma Sigma Phi Honor Society. Dr. Mullens will be training with Affiliated Dermatology for the next 2 years. And I thought, my gosh, of all the diseases, I just would imagine, since we're in the desert, don't we have more skin cancer here than in, say, North Dakota?
Absolutely, we do. Actually, skin cancer is most common here in Arizona comparative to the other states in the United States, mostly because of the snowbirds coming here to the United States down to Arizona during the winter months in the north. So our average population age is kind of the ripe age for skin cancer, that 50 to 80 years old. We're starting to see a lot of these skin cancers crop up, the sun-related skin cancers. So it's much more common here in Arizona. Second highest incidence. We're second only to Australia for melanoma. So we tend to actually follow a lot of the Australian skin cancer guidelines for some of the practice that and recommendations that we have for patients.
Okay, so this is Dentistry Uncensored. So I don't want to ask any easy questions. I want to get straight to the controversy stuff that I hear chairside for 30 years.
Yeah.
So I hear that you see this chart of skin cancer going up while you see the chart of using sun protection factor cream going up.
Interesting.
Like when I was a kid, I was born in 62. You're probably thinking I was born in 32, but I'm actually 62. There was no such thing as sunscreen. In fact, it was the opposite. You'd put baby oil.
Baby oil and iodine.
But here's the other part of what confuses the normal person who's not a dermatologist.
Yeah.
They say, well, you know, if I put on a bunch of sunscreen, I can go float the river for 4 hours. I can go golf for 4 hours. But if I didn't use sunscreen, and I'm Irish, I couldn't do it between 11 and 4. I have to do my hike on South Mountain at 6 in the morning. But so it kind of looks like, and I had a really smart engineer. He's like 80 years old telling me this big lecture on it. He goes, I think they got it all wrong. The more sunscreen they put on, then they go out in the wrong time. Without sunscreen, they wouldn't go out in the wrong time. And if sunscreen prevented sun cancer, then why is it going up? So I hate to unload all that on you as your initial question. You're probably going to cancel and just walk out right now.
No, you captured a lot of like the history that we've moved from and to over the past few decades. But getting to just sunscreen in general and sunscreen use, I agree. Back in the day, and when I say the day, 70s, even the early 80s, a lot of the sunscreen that we even had wasn't really worth a dork back then. It wasn't
worth a what?
A dork. Wasn't that great?
A dork?
Yeah,
I haven't heard that one.
Wasn't that great? Don't kick yourself in the butt. And I tell this a lot to the patients, the people that say, you know, I kind of grew up on the coast of California, and I have them now and say they're 70 years old, and they're saying I had a ton of sun history, and you know I'm kind of embarrassed about it. Well, the people that were applying sunscreen at that time, it wasn't that fantastic either, so they didn't really have too much of a leg up on them at that time. Now it's really improved. We've had a lot of improvement since then, and it's still improving. But the risk with sunscreen, we do know that, yes, you do see a trend of skin cancer incidence is increasing across the board in the United States for your non-melanoma skin cancers and melanoma, which is scary. Is very scary when you're looking at it by the numbers. We're talking skin cancer alone is more common than any other cancer combined. All other cancers, you combine them, it does not equal the total number of skin cancers. So
that's crazy.
It is crazy. And what is the actual number of skin cancers that occurs in the United States? We don't know the exact number. We have an estimate. We believe 1 million basal cells will occur over the year. You know, that's an estimate because there's no mandated reporting on these non-melanoma skin cancers. Now, melanoma skin cancers, yeah, we have a little bit more of a specific idea of the number of melanomas diagnosed. We're talking 2,050 melanomas will be diagnosed in the state of Arizona this year. We know that. Those are reported. That's your melanoma. That's the one that kind of makes the pupils dilate when we see those in the office when it comes through under pathology, because that can carry a much more higher mortality. So it's usually a little bit more complex, and it's a little bit more scary for the patient and the provider to go through. But the non-melanoma, the one that's related to...
That's what you call basal cell?
Basal cell and squamous cell. That's the #1 and 2 skin cancer respectively.
Basal cell #1.
Basal cell's #1.
Squamous #2.
Squamous #2.
And you call those to combine
non-melanoma skin cancers. They'll call them NMSC, non-melanoma skin cancers. And what those comprise of is a cumulative sun exposure is what makes you at risk for those skin cancers. When I mean that, I mean decades. I mean 20, 30 years of being outside, say a guy that works outside outdoors, say he's a construction worker over a 30-year period, so he starts at 18, I'm seeing him at 50, he's starting to get just the actinic or the pre-skin cancers that would precede these skin cancers. It takes decades typically to accumulate the skin damage from the sun aging and skin cancer causing rays to start building these skin cancers. So where do we see them? Sun exposed areas. We'll see them on the arms, face, neck, ears, nose, lips, eyelids, areas like that, backs of the hands. You know, much less common to see these, although it can happen on the trunk, thighs, butt. Usually it's on these sun exposed areas. Now, we can see it on the shoulders, you know, in the underneath, on the V of the neck and the chest. Those do get some sun as well. But that's typically where you see those sun exposed areas. And those are the ones that are most common here in Arizona because of our sun.
And those are all the non-melanoma?
Yeah, the non-melanoma skin cancers.
Skin cancers.
So when we talk about our population in Arizona, Ahwatukee, you know, in the greater area, we're really looking at people that are seeing a lot of those types of skin cancers. So when we have people walk in through the door and we're doing our skin cancer screenings where we're checking every area on their body, looking for any atypical or abnormal appearing spots or lesions, those are the ones that we're really typically seeing the most commonly, much more common than melanoma.
But those aren't as lethal.
Not as lethal. When we say lethal, we're meaning it obviously can kill you, but also we kind of use that term generally speaking for something that can metastasize, meaning spread from, say, the arm to a different location, either to the skin elsewhere or internally to an organ, so metastasizing. Melanoma is much more likely to do that. It can, you know, very common to go to the brain is a common place for it to metastasize for melanoma. That's scary.
So that I'm safe.
Well, President Carter, right? So Jimmy Carter, he had the metastasis to the brain, but they've got some fantastic new medications that are actually able to treat and sometimes melt away some of those metastases, and that worked for him. But for the non-melanoma skin cancers, we don't generally see metastasis or spread elsewhere. It just grows locally, and that can make it easier to treat, but it sometimes can be very difficult depending on the location. So when I said that these are the non-melanomas are going to be on sun-exposed areas, we're talking nose, we're talking ear, we're talking lips, eyelids, and boy, that can be disfiguring. If somebody gets a skin cancer on their eyelid or their ear or their nose, and you're talking about treating that surgically and removing that, that can really leave the individual disfigured depending on how big and aggressive that local tumor was. Well, now these non-melanomas may not metastasize, but they will grow locally, and over time, left untreated or neglected, or I'm talking years, it can continue to grow and maybe get a little bit deeper in the local tissue. So your final defect after you cut it out and remove all the cancer cells could be larger if you leave it untreated. And then to close that up is a difficult task for any surgeon. And there's actually been a special field called Mohs, or Mohs micrographic skin cancer surgery. Mohs surgery is the term that we use. It's actually an eponym named after a guy named Frederick Mohs. And he's an individual that created this type of surgery for skin cancers, specifically speaking for cosmetic areas, face, hands, genitalia, areas like that where you do not want to leave the individual disfigured. That can be life-changing. And so what you have are these individuals that are kind of not a step above, but they have extra training above a dermatologist, usually fellowship trained or society trained, meaning where they've acquired the total cumulative number of procedures to be able to attain that kind of specialization or expert level of skills. And what they do is they cut out real time. You come in with the skin cancer, say on the nose, and they'll go out and they'll chase the margin of just the abnormal skin cancer cells. Just chase around it. Traditionally, we'd take a wide excision out, and we know with 99% probability we'd capture all the abnormal cells with taking that nice ellipse outside of it with a margin. We know by just odds that we'll capture all the abnormal cells. Now with this Mohs micrographic skin cancer surgery, what they do is they just dance right around the outside margin of the abnormal cells. They cut that out, they put it on a slide. They have a specialist called a histopath tech. While that patient is there on the table, they take that tissue, they go plate it on a slide, which takes a special technique that they do. And then the Mohs surgeon at that time will take the slide back and look at it under a microscope. And when they look at it under a microscope, they'll have their coordinates of north, south, east, west, basically. Sometimes think of it like a clock, 12, 6, 3, and 9. And they'll know, based off of those margins, if they have all clear margins, meaning there's no skin cancer cells on the outside and at the base. And when they get to that point, then they can close the patient up. Not until then do they stop. So say at 3 o'clock position, they see just a little tumor cell right at the periphery. So what they'll do is they'll go to the 3 o'clock position on the patient, and then they'll just chase right around the 3 o'clock position. And they'll just try to capture just that area, because everything else is clear. So it wouldn't make sense to take another big cut. They'll just chase the 3 o'clock. And then they'll go and do the same process again. They'll put it on a slide, they'll go back and look at it under a scope, and then they'll see if they got it all cleared at the 3 o'clock. If they have it all cleared then they can close it up. Now that's one part of their specialization where they can cut it out and they can look at it under a scope and make the diagnosis of clear or not clear, and then go back and take more. That's one part. The other part is the kind of the art of being a Mohs surgeon, and that's where they actually have to close it up. And when you have to close it up on one of these locations like the face, boy, you have to be really good at what you're doing, because you want it to look like you were never there, or ideally as close as possible to like you were never there. So a lot of times what they'll do is they'll use different types of flaps and grafts and closures and rotations to actually mimic the normal skin folds that we have in just normal skin. So it looks like it's in the normal creases, maybe along the eyes or along the, the perinasal folds, and it'll just look like it was our natural creases. So when I look at somebody, my eye doesn't get drawn to something that looks kind of geometric like some other closures you might get on other locations. It may look more natural. That's a profession or a specialization within dermatology that was created, which I think is kind of fascinating. That field was created out of the need, and that's relatively speaking, it's a newer field in dermatology because of the need for it. This is where skin cancer is becoming so much more common, like you're talking about. We're living longer than we ever have before. So these things that are cumulative related to sun exposure, they're going to become more and more common as we live longer. And, it becomes a question of what's the most cost effective, what's the most cosmetically, pleasing, what's the most curative. Most surgery, generally speaking, for these non-melanoma skin cancers is superior in terms of cure rate. We're talking 98 to 99.5% cure rate with basal cell and squamous cell. There's no 100% in medicine, as you know, but boy,
you're saying basal and squamous,
yeah, it
but
gets
not
close.
melanoma.
Not melanoma.
So everything you've been talking about so far has been about non-melanoma.
Non-melanoma. Now,
and that's basal cell, and squamous cell. And you're saying the 5-year survival rate is what?
Cure rate is 98 to 99.5, depending on the surgeon.
So then its twin sister.
Yeah,
is melanoma.
Yeah. So melanoma, there's only the melanoma in situ in a certain kind of stage, or at least severity of the melanoma, will we consider doing what's called a slow Mohs, which is a hybrid of Mohs surgery. Whenever we're taking the tissue and putting it on a slide to look at it under a microscope, the type of processing that tissue undergoes is only good or ideal for these non-pigmented lesions. Whenever you try to do that to melanocytes, which melanoma arises from, it doesn't plate correctly, and it doesn't allow you to appropriately visualize the cells. And that's why it's not an ideal treatment option for melanoma in general. But there's what's called a slow-mo procedure, where we do the normal processing, which takes up to a few days to process and put it on a slide and have dermatopathologists review it. And then at that time, we cut it out, we'll do that process, and the patient will have a bandage over that wound site that's not closed yet. But they'll go through the same process as before, where they check the margins, the deep end peripheral margins, and then once we know that it's all cleared, we'll bring the patient back and then we'll close it up. That's because of the way that the tissue has to be processed for it. But
what's the 5-year survival rate on a melanoma?
So the melanoma, generally speaking, so if it's your first stage melanoma, your melanoma in situ, it can be 99%.
For stage 1?
Yeah, absolutely. And that's typically treated with what we call wide local excision, and that's a 5-centimeter margin. So it's a pretty good sized margin. You're talking on both sides of the actual defect. So they're going to
5 centimeter?
Centimeter.
5-centimeter margin.
They're going to get a 5.
So an inch is 2.54.
2.54 centimeters per inch. Yes. So it's going to be you're going to have a larger
big cut.
Absolutely.
So what do they go? Stage 1, 2, 3, and 4?
Stage 1, 2, 3, and 4.
So stage 1, you said it's 99?
Yeah, you can get to 99%. If you have a wide local excision that's done with a 5-centimeter margin, it can be up to 99% cure rate.
So what about stage 2?
Boy, it drops down to like 87%, and then it even drops down much further than that. You're talking
stage 3?
It's down to like the 50s, and then down below that it's even lower. I think it's like 25 to 30.
So the point is, skin cancer, you got to get checked regularly. I mean, you don't want to sit there and say, well, I haven't gotten checked in 5 years.
Yeah.
And they say, why? And you say, because my tanning salon insurance didn't pay for it. How often should you get checked? And should you get checked more regularly when you're 55 like me versus 25 like Ryan?
Good question. So skin checks, we base those off of the patient, meaning risk factors for the patient. So age is one of them, where we kind of look at that, and throughout the United States, we kind of agree that anybody over 50 should be getting a skin check at least once a year. Now, in the geographic regions where there's a high UV index, such as Arizona, Ahwatukee, we recommend that younger individuals come in and get a baseline. It's a very good idea to get a baseline because you could have kids that are getting sun exposure. We have 300 plus days of sun a year here. You compare that to somebody in Pennsylvania, say, or Kansas.
You were born in Pennsylvania,
yeah,
right?
absolutely.
So,
and we're talking like 90 days of sun.
So do you think Arizona, from where you were born in Pennsylvania, which is pretty north?
Yeah.
So do you think we have like twice as much as Philadelphia, or is it just like maybe?
Oh yeah, absolutely. So we're talking in terms of days of sun exposure. I'm talking 300 plus here in Ahwatukee versus, I mean, you're stretching it. Yeah, you're stretching it 90 to 150, and then you're talking most of those months, from October to March in, say, Philadelphia, PA, they're going to be wearing long sleeves.
Damn. So if we lived in Philly, not only would we have less skin cancer, we would have won the Super Bowl.
We'd be Super Bowl champs.
Oh my God! I picked the wrong state.
I don't know about that, but yes, that puts us at a risk just by birth if you're from Arizona. You're kind of behind the 8 ball, so to speak, with that in regards. But there's other factors that we look at, risk factors. Redheads in Ahwatukee, Arizona, they're going to be 13 times greater risk of melanoma than an average person in the population. So redhead,
and those would be pretty much all Irish and Scottish?
Yeah, and a mix of the above.
You know what's funny about here? I've lectured to dentists in 50 countries.
Yeah.
Most countries, like you go to Vietnam, they're all Vietnamese. You
go
to Korea, they're all Korean. You go to Japan, they're all Japanese. Even like Poland, they're all Polish. You come to America, no one even knows what they are. It is the most mutt nation on earth. And everybody is a mutt.
And that's what makes it difficult for a lot of our studies in the United States.
Yeah, exactly.
Or at least comparing them to, say, a Denmark study, because it might not reflect what we're seeing day to day in our offices. But we do know individual risk factors, redheads, freckles, blonde hair, blue eyes, those are all going to be high risks.
So me personally?
For you, so blue eyes. Right there off the bat, I'm looking at you, you know, blue eyes. You're going to be high risk factor.
And you think
for skin cancer.
How many times higher?
We'd have to go through the risks of family history of skin cancer, personal sun exposure. Have you used a tanning bed before? How many burns have you had? You know, there's all these things. You know, occupation. You're a dentist. You've been indoors.
But then on the other end of that deal, so many people. I've had so many African-American friends and patients say, yeah, I don't have to worry about that. I'm like, dude, Bob Marley died of skin cancer. And they're like, no, he didn't.
Yeah,
I said, Google it.
Yeah. So
I've shocked some kids in Ahwatukee.
Bob Marley had he had a melanoma on his big toe.
Yeah.
And he used to play soccer without shoes. And he thought it was an old soccer injury. So he had this black spot underneath his toenail, and the thing kind of just never went away. He thought it was an injury from soccer, and that's what killed him. You're absolutely right.
Yeah, I've told little African-American boys in my practice this tall, and they're like, no.
So melanoma can happen in the eye. We have pigmented cells in the back and the retina. So we have pigmented epithelium in the retina. It can happen underneath the fingernails. So in African Americans,
I want to go back to one thing. So when you were talking about basal cell and squamous cell,
yeah,
it's not like it was all the sun exposed area. So you're
typically,
actually you actually believe in sunscreen.
Oh, so to get to the point of sunscreen.
And what's a better sunscreen? A shirt on?
Yeah.
Or putting cream on?
So, yeah, I guess, you know, I did leave that out. The sunscreens, I am a huge believer in sunscreens, absolutely. And
does sunscreen protect not just basal and squamous, but also melanoma?
Yes, absolutely.
So then you're saying that the melanomas would be more likely to occur in the same area?
Interestingly, that's the confusing conundrum with melanoma. There are some melanomas, depending on the type, because we have different subtypes of melanoma, like a subungual on the hands or an acral melanoma. We have a lentigo maligna melanoma, usually slow growing on the sun exposed areas like the face. Superficial spreading melanomas, you can see those on the trunks, in the back, in the butt, and the thighs. And those locations where sometimes we see them most commonly aren't sun exposed areas. But now that we have genetic profiling and mapping, we can see that what we call UV signature, mutations in the melanomas that are related to UV exposure, but they're not the sole driver of the melanoma. It's an accumulation of mutations, and sunlight can contribute to acquiring more mutations, being more likely to go aberrant and become a melanoma. But there's genetics that play a role in this as well. We know there's certain genes that can be related to higher risk of melanoma and skin cancer in general. But that's a fantastic point that you made. So yeah, sometimes we'll get young individuals coming in, and anybody really, if we're pulling an abnormal mole, or we call it dysplastic nevus, it might be on their back. And they might say, well, you know, I really haven't had a whole lot of sun exposure there. Can you explain that? It's a combination. Genetics, if you have over 100 moles, over 100 moles will put you at a higher risk. If it's greater than 2 centimeters or 20 millimeters, that could put you at a higher risk. There's different things that could be inherent within that could place you at a higher risk. Now, sunscreens, oh, you betcha. There's some better sunscreens than not out there, and it can really vary on the SPF level. The minimum level of SPF that you need to prevent skin cancer and the kind of the sun aging rays is SPF of 30. Now, there's also too much of a good thing, and we know that, and we're actually learning that right now. What we're learning is, you know, some patients will ask me, why would I get an SPF 100 if 30 is all I need to prevent skin cancer? Well, the way that it's recommended per, you know, square or cubic inch or centimeter squared of area to apply, it's actually a pretty thick layer. Not a lot of people like putting a thick layer of sunscreen on. And when you're applying a SPF 30, like we generally do, 99% of the population, actually only one out of 10 people wear sunscreen. So we're saying
how many?
1 out of 10. So
only 10% wear sunscreen.
And a lot of those studies that they pull that from is actually a lot of females that wear it in their makeup. And so not a lot of people wear sunscreen.
So you're a big believer in sunscreen.
And now SPF 30 to 50 is generally what I recommend. I like SPF 50. Now for people that are higher risk, for people that like applying it very thin, which a lot of us do, that's where the benefit comes from by buying or purchasing an SPF 75 or an 80, because it's going to allow you to apply it thinner. It'll behave more like an SPF.
Do brands
30.
matter?
Good question. Actually, some brands are better than others, but sunscreens can really vary on price. And more expensive does not always mean better. Neutrogena in general makes some really good products that are also affordable. So when you're talking, you got kids.
And what is Neutrogena? That's a brand?
Yeah, Neutrogena is a brand there, and they have a sheer zinc as an SPF 50. And there's a ranking system that we kind of know of where they look at the chemicals that are in the sunscreen, because you can have a chemical-based sunscreen which basically takes the UV rays and absorbs that and diffracts and deflects the energy so it doesn't reach the skin and the cells and cause genetic mutations and damage and aging and risk of skin cancer. So that's a chemical blocker, and you also have a physical blocker. Your physical blockers are what we really favor, but a lot of the patients tend not to like historically, because that's what we associate with the white paste on the nose on the guy at the lifeguard at the beach, because it's a zinc oxide or titanium dioxide. I like zinc oxide based sunscreens better. That's going to provide what we call broad spectrum. There's two types of UV rays that we try to protect from, the UVA and UVB, and broad spectrum means that it blocks both of those. Your zinc oxide based sunscreens are called basically they're natural, so it's going to be a natural blocker, and it's a physical blocker. So Neutrogena makes a sheer zinc. It goes on dry, and you can put your makeup on over top of it if you're a female wanting to put makeup on, and your moisturizer. It's very easy. It's a little bit more elegant, so to speak, and they kind of make these nanoparticles with them now. That's one of the technologies that we have, where it makes it a little bit more pulverized, where they're able to apply it, and it's not just white paste. It's a lot smaller. So it's a lot more tolerable for people to use day to day. They can use that. So I favor the zinc-based titanium dioxide over titanium dioxide, but I'll take the physical blockers over the chemical blockers any day of the week.
So what do you think's better, a blocker or avoiding certain hours of the day?
So the most important thing is to always be wearing sunscreen no matter the time of the day. It's important to have sunscreen on, especially if we know we're going to be outside. Sun exposure starts when you walk outside to your car to go to work. While you're driving to work, we get a tremendous amount of sun through the left side of our driver's side window. That's why we see skin cancer on the face is more common than the left side. So it's certainly we're getting that exposure from getting out of our car, going to work, going to lunch, those times. So we're getting it throughout the day. The worst parts, you're absolutely right. Typically between 10 and 2, or even out here 10 and 3, 10 and 4. Is our peak hours, and usually we say if you can't see your shadow, run. That means the sun's right above you, and that's at its peak.
I've never heard that. Yeah, that's a great one.
But that's just kind of, you always seek shade, but I like where you're going with this. In terms of, is there a better option than sunscreen? I think sometimes there is a really great alternative to sunscreen, depending on the function or the activity that you're doing. A lot of hikers, we're not going hiking for just 2 to 3 hours. You're recommended to reapply sunscreen every 2 to 3 hours. Now, what if I'm hiking and it's hour 3? Do I want to sit down and just lather up again? Do I want to get that out and go through that whole process? Well, ideally, if you didn't have anything, no other option, yeah, I'd recommend that. But what we have now is we talk about sun protective clothing. And sun protective clothing actually is just clothing. Any clothing in general is going to be sun protective. Now there's certain colors that are going to be better, like your reds, your black, your dark colors are going to be a little bit more protective. The ones that are going to have less, they're going to be more of a thread count, higher thread count, tighter weave of the actual threads, that's going to be more protective. And now we actually rank clothing on how well it protects you from the sun. It's called UPF, ultraviolet protective factor. And Basically, that's just a fraction of the amount of UV light that's able to penetrate the clothing and reach the skin. So a UPF of 50 means 1/50th of the UV rays can reach the skin through that clothing. So you wear long sleeve clothes, which you can get some really nice, light, breathable clothing. It's long sleeve. I wear it myself golfing. I golf out here and it can get hot out here. And you can get long sleeves, you can wear pants, and that's sun protective. That's not, you don't have to have sunscreen on if you're wearing that sun protective clothing. Wide brimmed hat, we typically recommend a 3-inch hat all the way around. Protects the ears, protects the face. That gives you.
But is that only between 10 and 3?
No, any time of the day. Any time of the day, this sun protective clothing is fantastic.
So again, Dentistry Uncensored.
Yeah.
By the way, you're an amazing man. I mean, you're just like, he has no notes, no PowerPoint. I mean, he's like Beethoven on a piano. But then my patients are hearing exactly the opposite information, saying, well, you need to go out and get 10 minutes. You should be eating your lunch outside because you need melatonin. Yeah. You need vitamin D.
Absolutely.
And they're saying that the typical person who wears their clothes to work, if they sit outside their whole lunch hour, they won't get enough. Mm-hmm. But if they were in their backyard and they could strip down to their
get naked and go outside for 10 minutes,
it's 5 minutes on each side. So that's very that's very opposite information.
It is. And some of the most intelligent people I've ever met in my life believe in that. Not dermatologists, but historically some dermatologists did believe that sun was good. And to a degree, a little bit of sun is good. 5 to 10 minutes over, say, just the arms is quite enough to get your daily vitamin D. Actually, most of our vitamin D comes from our diet. But
really?
Yeah, absolutely. And a lot of our greens, we get a lot of our vitamin D through that, our foliage. So a lot of vitamin D is dietary. But sun exposure can help with a little bit of an additional type of vitamin D that we can make.
When you say greens are good, what type of green candy are you talking about?
Just any greens, leafy.
When you're on an Easter egg hunt, get the green eggs and not the yellow, pink, and purple.
So
vitamin D's in greens.
Yeah. So a lot of your diet, you get most of your vitamin D.
So then the other one would be, the only one that you have to get from the sun then would be just melatonin?
Melanin? So the sunlight, melatonin actually does play a role in. So the melatonin, like with sleep, our sleep cycle, a lot of it is based off of seeing natural light. And that means how we're going to feel. If we're seeing less sunlight, we're not going to feel as good overall. Our general sense of well-being might be lower. That's what a lot of us in the North known as seasonal affective disorder.
Seattle.
Yeah, so
Philly.
You go where you don't see the sun for 4 or 5 months, you're going to start feeling down. You're not going to feel as great.
You know what my dentist friends in Alaska say? If you live above the 35th, or
whatever latitude.
Yeah, and north of Fairbanks and Brook Range, where in the winter it'll go completely dark for like 3 or 4 months.
That has an effect on you.
And they said that the alcoholism rate doubles or triples. It'll go from 15% to 30%.
What are you going to do when it's dark
when the
all the
summer
time?
comes out, they say, what did you do? And they go, I bought 20 cases of vodka and went and slept in my trailer for 3 months.
Yeah, it's 0 degrees out and there's no light. So it does have a role. And sunlight, from the time that we get up, within that timeline of us seeing natural light outside, that has an effect on arousal, activity, just being in wakefulness. So it has sunlight and light in general has a lot of positives. I don't want people to turn into a vampire and never go outside. But I want them to...
That was my next question. Do vampires ever die of skin cancer?
Yeah, do they? I don't know. Maybe.
You know who my favorite character is in every vampire movie? The sunlight.
The sunlight? Those cloves of onion, I don't know, or garlic or whatever it is.
So you say, so then what's your final professional recommendation about if they think I need 10, 15 minutes sunlight every day for
I'd say
vitamin D and melatonin?
So 5 to 10 minutes of the sun-exposed areas outside of direct sunlight is plenty enough. If you're somebody that has a sensitivity to sunlight, where at 5 minutes that you could start seeing any type of redness or anything like that, the 5 minutes that's enough for you. But it's not an absolute must. Like I said, we get most of our vitamin D from the diet, but I think a little bit of natural sunlight, just a little bit, 5 to 10 minutes of those sun-exposed areas, just the arms, face.
I want to ask you some more urban legend questions.
Yeah.
You know, again, these are real patients asking real questions.
I'm going to try to answer them. Yeah, I'll do my best.
That bachelors have a higher mortality rate from skin cancer, from melanomas, because they don't have a lover who noticed a spot on their back. For instance, I have 2 dentist friends who were legends. One was in Ohio, where you went to school, and one was in San Diego. And the guy in San Diego, I think he was one of the first dentists ever in the world that reached to placing 30,000 implants. And he was Polish, and it was right in the middle of his back.
Yeah.
And he said, whenever I was around another human, I had a shirt on.
Yeah.
Both guys had the same thing. They were both bachelor men. No one ever saw their back. Both of them wondered, if I would have been married, do you think my spouse would have said, hey, there's something on your back? So my specific question is,
being single, does that put you at risk?
Does being single have a higher mortality rate because you don't have a lover noticing something?
You know, in theory, that makes sense. I don't know the specific, I don't know the true numbers on that, but in theory, that makes sense thinking about it. We recommend that spouses and couples, they do skin checks on each other. We recommend it, monthly. We teach patients what to look for. We have what we call the ABCDs of melanoma. I don't know if you've ever heard that. I have. So the ABCDEs of melanoma are something that we tell patients to look for. A stands for asymmetry. So if I can cut it down the middle, is it a mirror image of itself? And whenever something offends any of these rules, the ABCDEs, that's when we say, we want you to make note of that. We want you to come in and let us know where you saw that, and we're going to look at it.
I think that's the most natural thing for you, because everything is symmetry. A pine tree, a Christmas tree, 2 hands, 2 feet. I think I think when someone's like nose deviates to the left, or I think asymmetry is, for some reason, I just think humans pick up asymmetry.
We do.
Like that.
We do. So that's absolutely one of the things that we look for, because generally speaking, if we're thinking that it could be a melanoma, that asymmetry means if it went from something perfectly symmetrical, perfect circle, and now it's starting to get maybe a little bit almost like a Mickey Mouse ear over on the side of that perfect circle, that means that there's activity that's occurring at that area, maybe that 2 o'clock position. Well, is that activity normal? Well, it doesn't make sense that all of a sudden you're getting this new activity that's sprouting out on its own. It's not growing as a whole, kind of progressing in a natural evolution with itself. You're starting to see a little bit maybe increased activity there. And that kind of brings me to the next part of that ABCD, is the B, the border. So is the border nice and smooth, or is it kind of irregular? Does it have almost finger-like projections, or is it jagged? Is it not a nice smooth contour border? Usually whenever you see a muddled or kind of a jagged border, that means that there is some activity that's a little bit bad or atypical. So that's another feature we look for. Not only is it asymmetric, or is it symmetric, does it have a smooth or jagged border? I like smooth, I don't like the jagged. So that's another thing that we look for. C is color variegation. So what I mean by that is it more than one color? Is it brown and black? Is it brown and white? Is it brown and blue? Brown and red? Multi-toned? These are things that would be suggestive of potential risk for melanoma.
So you want it one color?
I want it homogeneous. I want a nice one color. Now, nothing, if you look close enough, is one perfect color. But I'm saying grossly from the naked eye, looking at it, generally speaking, does it look like it's homogeneous or one-toned? But once you get up close enough to anything, you can see multiple colors, of course, or at least tones of that color. But I'm talking, is it brown and black? Is it tan and brown? Is it tan and blue, tan and white? Is there multiple colors within that lesion? Or maybe a new color within it? These are things that we're looking for. The D, that's diameter. So diameter of 6 millimeters or greater, so size. So 6
centimeters?
6 millimeters.
Oh, 6 millimeters.
Okay, a pencil eraser. A pencil eraser.
2.54 millimeters is an inch.
2.54 centimeters is an inch.
2.54 centimeters is an inch.
So 6 millimeters. So it's just over half a centimeter. It's a pencil eraser essentially. So if I could take that pencil eraser, stick it over that pigmented spot, in general, that's a reassuring feature. Not a guarantee.
So if you can cover it up with a pencil eraser,
that's basically 6 millimeters.
That would be good.
Yeah, absolutely.
But if you put your, I don't even think they sell erasers anymore, do they? Does anybody, you know anybody who uses a pencil? You're giving away that you're an old man. But your ballpoint pen. That's
just to give some people, because sometimes they'll say, well, when I'm doing a quick look, what is 6 millimeters? And it's basically a pencil eraser diameter. Again, not a guarantee, but if it's greater than that, I want to hear about it. The E, A, B, C, D, E's is evolution. Is it changing in any way? Is it a mole that you've had that's changing in any way? Is it evolving? If it's changing at all, I want to know about it. So those are the self-checks that I have a patient do. And I want them to look for all those, and they apply it. So they see a pigmented spot. Okay, does that look like it's symmetric? Does the border look smooth or jagged? Is it one color? Is it 6 millimeters or less, and has it changed at all? I want them to look at all those. Sometimes change, if it's kind of equal to all the other change, it's growing, but maybe it's growing in proportion to everything else, more of a reassuring feature.
Some people say, some people wonder, well, what if you got like a mole?
Yeah.
Or a skin tag? Would it just be smarter just to cut that off? Is that, if you're born with a mole, and some people will have 3 or 4 of them. Are they higher risk, or
would it make sense just to cut that thing out and prevent any possibility? No. We kind of look at the morbidity associated with just taking out just a mole in general versus allowing them to sit and monitoring them. Now, if there's any of these features that we see that we mentioned there, or any other historical features from just the patient reporting or risk factors of previous skin cancers or risks, maybe through medications or medical history, then we may biopsy it. And if it came back abnormal or atypical, then we may recommend that we get that removed or excised. And what that is not only treatment of the atypical nevi or mole, but it also, you can think of that as a prevention of the potential to go down a path to evolving into a melanoma. So just at face value, any mole, just to excise it, is not a recommendation we have. We do recommend that you get any mole, if you have moles at all, if you're concerned or questioning them at all, you would come in and let us look at them at the dermatology office. And
by the way, tell them what it is. You know where 40th Street is? I mean, it starts up at Corpus Christi, goes down past Fry's at Ray Road, then you go down to Chandler, and there's Safeway and Fry's, and then you keep going towards Pecos. Halfway between Chandler and Pecos is the medical dental building. So you just turn there, they're right in there. I hope all my questions don't annoy you, because I'm 55, so I've heard a lot of these questions, and practicing in Arizona 30 years. I can't tell you how many times I heard this. It'll be like a 70, 80, 90-year-old woman golfer at Ahwatukee Lakes, and she'll say, well, I don't have to worry about skin cancer because it's the burns you got when you were 10 that 30, 40 years later killed you when you were 50. So
I've made it past that hump.
So now that I'm 70 years old, if I got too much radiation now, it wouldn't be cancer till I was 110.
Actually, 70 years old, in the 70s is the most common time for melanoma.
But is that true though? But when she's 70 and gets a melanoma, was that from a bad burn when she was in a bikini at 20?
So, beautiful point. Remember earlier I was saying melanoma is kind of the oddball because we see a lot of those arise, not all, but a lot of them arise in areas where we generally don't have exposed skin. Chest, back, butt, thighs, areas where we're saying, no, that can't totally be related to just sun. Correct. But what do we try? The way we've tried to explain why we see this occurring is we think of the guy or the girl that lives in, we'll say, Pennsylvania again. It's springtime. It's April. We had our first couple weeks of nice sun. What does the guy do? He goes out in the lawn, takes his shirt off, mows the lawn, gets a nice burn. What does the lady do? Maybe she goes and lays out in the sun, gets a nice burn on the thighs. And then you start looking at the numbers of the most common locations, anatomically speaking, for melanomas for guy-girl. You start saying, okay, well, back, chest, neck, scalp, guys, thighs, butt, back, abdomen, females. You start wondering, is there association with those few sun exposures that aren't commonly exposed areas, but when they do get exposed, they might get a little bit of a burn there. And that's what we do think is actually occurring. So it is those rare or less common times that they get exposed, but they get a little bit of a burn there. Not necessarily when they're 10, but we think it's those few bad burns on areas that aren't generally
So you're
exposed.
saying then that the woman should be mowing the lawn and the guy should be laying in the lawn chair drinking a beer. That's all I took from that story.
All duties should be equal. Yeah.
So back to risk factors again, and come on, guys, you just got to get checked every year. I mean, they're right there.
I think the good point out here, like with the 70-year-old golfer. I golf all the time. I love being outside. I've been in the Ahwatukee area to the baseball fields with the 9 and 10-year-old baseball players. We come down here with Pop Warner football. We get involved in the community. A lot of people, we're outside. That's why we're here in Arizona. It's a beautiful place. We get to be outdoors and active, which I love, people being healthy and active. But with that, I get a certain subset of people, even family members I can relate to, where they think that maybe they're a little fearful or hesitant to go into a dermatologist, maybe because they have this, some of the skin changes of being outside and having poor sun behavior habits. Don't let that keep you from coming in if you have a tan or a burn or anything like that. You're the person that we want to see in there. You're the person
and nobody
that we can
should
help.
make you feel bad. I mean, you're basically a summary of the 5 people you spend the most time with. And if you spend a lot of time with someone that makes you feel bad or is toxic, the number one thing you need to do in your life is get that person out of your life. And if you go to a doctor, and look, when I was little, all the OBGYNs were men, and all the women said they didn't listen to them. Now, I'm a half a century later, all your OBGYNs are women. And in fact, I mean, think about that. From the culture, I mean, they'd say, when you say, well, I'm having post-traumatic depression from having my baby, and, they'd say, quit being hysterical. Hysteric, Greek for uterus. That's saying quit thinking like a uterus.
Postpartum blues.
So everyone knows half a century ago, all the doctors were male, and the women said they didn't listen. So if you go to your doctor and you don't feel like you can talk about anything, no matter how personal or private, and sometimes if you're there and you want to ask a private question, but you're in the exam room, the door's open, say, hey, shut the door. And if the assistant's there and you say, I don't want to even ask you this from the assistant, you're in charge. You're the customer. You can go anywhere you want. If you say, I don't even want to talk to you in the exam room, I just want to go to your private office. Just you're in control.
Or maybe they may call and they say, I'd really like to talk to the doctor if I could, and maybe I don't want this message related. Could I talk to them personally? I think for our group, Affiliated Dermatology, what attracted me to come to this group and work with them was it's a family-based, community-based group. I mean, we're talking, everybody's got kids, we go out into the community, we get involved, we offer free education to the school systems.
How many kids do you have?
Me, I don't have any kids yet myself.
Oh my God, you're a genius. Ryan, give this the Genius Award, my gosh. But a lot of people in Ahwatukee, and by the way, if you're listening to this on YouTube, subscribe to our YouTube channel, youtube.com/Ahwatukee Uncensored. But remember, we're on iTunes, so the show's really taken off because a lot of people have an hour commute to work. And that's my other question. What if it's not convenient? I live in Ahwatukee, but I don't want to go to your Ahwatukee location. I'd rather go see you on my lunch break. Where are your other 5 locations?
That's a great question. And like I said, we're such a huge presence in the local communities, we really do have a nice spread of locations to make it more convenient to the patient. We have a location in Gilbert, off South Higley. We have a location in North Scottsdale, right across from the Thompson Peak Honor Health Hospital in the Greyhawk Medical Center building. That's North 73rd Street up there. And we have a location in Deer Valley across from the Honor Health Deer Valley Hospital. So that's an easy kind of...
I'm so sorry. I've lived here for 30 years.
Where
is Deer Valley?
So the Deer Valley Hospital is off, it's off the 101. It's on exit, I believe, 23 off the 101. It's right there on your left.
So real North Phoenix?
North Phoenix, exactly. Okay. Over toward like Pinnacle High School, over that way. That's where that
you would not believe what an Ahwatukee recluse I am. There's no, I mean, the only time I leave Ahwatukee is to go to the airport.
You're in the Ahwatukee bubble.
I mean, there's 85. I grew up in a small town in Wichita, Kansas. This is 85,000 people. This is a good. This would be
when you have everything you need.
This would be the third largest town in Kansas.
Yeah, when you have everything you need within a certain distance, you know, why go elsewhere?
So you got Ahwatukee, you got Gilbert, you got North Scottsdale, you got North Phoenix.
Yep, we have one in Anthem, which is north on the 17.
On the way to Flagstaff.
Yeah, exactly. Okay. So that's probably, I'd say, off the 101, 17 exit, it's about 10, 12 miles north.
You know, a lot of people call Anthem North Ahwatukee.
North Ahwatukee?
I mean, they really do.
I can see why they would. I love Anthem. Anthem is such a cool little community. I see a lot of similarities to Ahwatukee and Anthem. I see a lot of families there in Anthem. It's actually, it was just a booming place right before the bubble, you know, before the bubble popped.
But you know, those real estate bubbles, they're up and down. They're always going to happen.
Yeah, I know, but it's a great place.
But the fact that Bill Gates, one of the I guess the richest man. I mean, it goes between Bill Gates and Jeff Bezos, depending on what Microsoft stocks.
Yeah, right.
So like Amazon stocks tanked like 10% in the last few weeks.
4% last Friday.
Yeah. So now I just read that Bill's back to #1, but he just bought 20,000 acres of land.
I heard about that.
Off the side of that, and then they're going to build the interstate straight from here to Vegas. Which Anthem will be back, but it's a beautiful city. What's your sixth location?
The other location's in Surprise.
Well, that surprises me.
Well, that's another place that's growing.
I had a patient once who put on her eyeliner, and it was too high, and she looked surprised.
Did she?
Yeah.
Wow, was she surprised when you told her?
So Surprise is west of Sun City or north of Sun City?
I believe it's west and maybe a little north.
North. That's about where Gates bought that deal.
Really, it makes sense. Like I said, there's a lot of land out there, but it is booming. It's growing.
You know, this whole area is booming. I mean, out of the whole world, Google chose Phoenix for their driverless car program. Bill Gates could have gone anywhere he wanted to, and he wants to build a high-tech center out there. Yep. And what my dentist friends are telling me in Silicon Valley is that you can't even get an employee, because if I hired you and even paid you $1 gazillion, you can't afford to buy anything. You can't afford to live there.
No, taxes are ridiculous.
Taxes, price of real estate.
This part of the country is everybody's gonna. I heard U-Hauls, you can't get them. They're so difficult in San Francisco right now. Everybody's just running. Yeah, everybody's leaving. They're coming to places like where we're at.
Dude, I went to. These are true stories of visiting dentist friends. One time in Manhattan. He told me what he paid for his rent, and we went in this 100-year-old building, went up this crinkety little elevator,
like
went
into this
shoebox with one little window, and I'm like, dude, that could be a mortgage on a mansion.
And
then the same thing in San Francisco. The guy, it was so small. It was like 3 people, and they were on air mattresses.
I worked at Columbia Hospital in New York City, and when I was there, I split with a guy that was at NYU Dental. It was a ridiculous price, and it was air mattress sized place to stay in.
So
where you had to blow it up and deflate
this is going to be the next Silicon Valley.
I think it is, and the nice thing is it's such a newer development. Everything's being planned so well. You know, if you look at whenever we have maybe the Waste Management Golf Tournament or another big event where you bring in 1 million people over a 3-4 day period, and you see you might see a little bit more congestion, but you don't see where everything's just shut down and you can't drive. We're able to accommodate it. But
Trivial Pursuit.
It's not a Boston type of design.
You just talked about the waste management golf deal. What's the biggest event that attracts the most people in Arizona?
Is it the horse show?
The horse show?
Yeah.
No one ever gets it.
Is it that? What is it?
It's the NASCAR.
Is it? You're kidding me.
I mean,
you're talking about one day, one single day.
Right, yeah.
Total though, we had over 750,000 in the golf tournament.
Right.
Yeah.
That NASCAR event. I mean, that's a religion.
Yeah.
What's that one thing? Burning Man out in the middle of the desert. What
Burning Man? I know of.
Burning Man. I mean, it's insane. I mean, people drive here.
Yeah, absolutely.
I mean, when I've gone out there before, you're born and raised in Philadelphia. I remember seeing 3 green RVs that had Philadelphia Eagles on them there.
Yeah.
And they're out there charcoaling all that stuff. And I said, you did not drive that from Philadelphia. And they go, oh, yes, we did.
Yes, we did.
For a car race.
Yeah, absolutely. Yeah, you're right. It can be.
So, by the way, where in Philadelphia were you born?
So I was actually outside of that. So actually, the county is what people might associate. Cameron County was the location. It's more north central PA.
Cameron County, and then you went to college in Ohio.
No, Coastal Carolina. I went down there actually originally.
So you went to South Carolina.
Yeah.
What city there?
So that was in Myrtle Beach.
Oh my God, golf. That's.
So is
there more golf courses in Myrtle Beach or Arizona?
Per square mile, there are more golf courses in Myrtle Beach than anywhere else in the world.
So Philadelphia to Myrtle Beach, and then college and
then I did college there, and then I did med school in the upstate of South Carolina, and then I went to Ohio University and worked at that hospital, worked in the hospital, and then came out here to Arizona.
Well, I mean, it's not every day you meet someone that's lived in 5 different states.
Yeah, I mean, by way of everywhere.
So it looks like. So, are you glad you're here? How long you been here?
Oh my God, yes.
How long you been here?
Almost 2 years now. Every now and then I do have to pinch myself because I'm in having great people, safe community. It's a stable community, good education system. It's only getting better, very affluent. There's a tremendous opportunity to really plant some roots, get a family, have kids, and really settle down. This is the ideal place, and I love the outdoors. Golfing is one of my passions that I've obviously.
Yeah, you went to Myrtle Beach.
I got recruited for golf there at Coastal. Actually, Dustin Johnson was on the golf team when I was getting recruited.
You're recruited for golf?
Yeah, so Dustin Johnson's the #1 golfer in the world right now. He was going to that school at the time. So it's a big golf school.
So what do you like more? You were a wrestler.
Yeah.
You're wrestling or you're golf?
You compare anything to wrestling. It's going to be tough to say wrestling. It's so difficult. But what was more maybe more of a life lesson type of sport wrestling, hands down, because of the mental stamina that you had to have to match the physical component of it was unparalleled. But golf was just too enjoyable.
You know what? I could not have been a dentist if I wasn't on the wrestling team.
I'm telling you, everything's easy after wrestling. Why, did you lose a tooth wrestling?
No, this is a true story.
You had a eureka moment?
I was born in '62. When I was 72, my dad bought this new franchise that no one of you heard of, because that's when franchises were rolling out. And the franchises were rolling out because the federal government was building these interstates. And before there were interstates, nobody really was, they born, raised, reared, and died and never went 100 miles away from home.
Yep.
So then people would walk out and they'd see this interstate in Kansas. They say, well, that'll take you all the way to Disneyland.
Yeah.
So that's when people started moving. Then when they got to the next town, they wanted something familiar, because you wouldn't know what Joe's Bar and Grill was. So my dad bought a franchise, probably never heard of it, Sonic Drive-In.
I haven't heard of it.
and he was expanding those out, and I think he got up to 9. And all the franchise, my dad got so mad at me that I wouldn't drop out of high school because he wanted to put me in a franchise.
Family business.
He wanted me to go to Abilene, Kansas, Kearney, Nebraska, Childress, Texas, and he's like, why are you in school? This is stupid. And then he'd look at my tail and be like algebra. And he goes, this is stupid. But I wanted to wrestle. And you couldn't wrestle unless not only were you in school, but you had to have you had to
maintain grades.
A 2.5.
Yeah.
So I only stayed in school to wrestle.
Wow.
And then my dad lived next door to a dentist. and I would go to work with my dad, and he'd make a cheeseburger and a French fry.
Yeah.
And I go to work with Kenny Anderson, and he'd take an X-ray of a tooth and work on it with his hands and do surgery on a tooth. And I was just
totally
like, Dad,
different world.
I said, I love you more
awesome.
than Kenny Anderson, but I don't want to make French fries and onion rings my whole life. So the bottom line is, and then I see that today because, I mean, let's just keep it real. There are a lot of businesses, whether they be yard maintenance,
landscaper,
where the father is putting a ton of pressure on those kids. Look, I need a hired hand. I can pay you $20 cash an hour under the table. You could buy a nice car. Why are you going to Desert Vista? I need someone handling. I got someone called in. I got kids sending me every time one of my dad's workers calls.
You're paying for school right now, and I could be paying you. You could be making money.
Yeah.
Right? Is that, it's two different kind of two different worlds. You know, and it is.
So what would you tell that kid at Desert Vista or Mountain Point, whose dad's saying, "Dude, I can pay you $20. We install sheetrock.
Yeah.
We install roofs. We do land maintenance."
I've done those jobs myself. Those were my winter jobs when I'd be on school break. I did construction where I hauled around all the heavy stuff and the scrap and cleaned up. And I've had friends that went and worked with their dads. My dad was a logger, and he worked with his dad that logged.
Logger?
Yeah.
In Philadelphia?
No, North Central. Like I said, we were a little bit outside of there.
I keep
but yeah, absolutely. It was the least populated county in the state, 97.5% forested. So my dad did that, and he was pushed into it, like you said, or he wasn't allowed to do sports. And it was that go into the family business. You need to help contribute to the family to provide. But I would say, one that is a unique and special thing for a son to work with a father in any job. I think that's something that I would absolutely cherish, and I would respect anybody that went into that and chose to do that, because I think that's a special thing not many people have the opportunity to do if they want to do that, if the kid wants to do that. But if they think that there's something else that they're passionate about, well, then I think that any father, at least I would hope, would want their kid or son or daughter to pursue what makes them passionate and wants maybe get them up every morning. So if that's something other than that,
and that is the one thing,
that's not a bad thing for there's times that your parents will get mad at you. That might not be a bad one for them to be mad at you. If they do, they'll probably get over it. One
of the luckiest things about my life is I've never worked a day in my life. Because all through from age 10 to 20, when I went to work at Sonic, I was with my dad. And I got free hamburgers and cheeseburgers. And those car hops were gorgeous. So, I mean, that was like going to, that versus staying at home. And then, but I'm so glad I followed.
But the learning experience, right? So, like, you got to see with your dad, I'm sure, the management and kind of running things and knowing how that all works. And if you saw that from 10 to 20, you're probably 30 years ahead of kids your age. People that don't learn a lot of life lessons, a lot of lessons on how all that business and all that works. Boy, that is a great opportunity if you do have a parent that's in a business. Then I think that's a benefit of going in when you're younger, at least being exposed to that stuff. I'm certain
I saw that when Dennis got out of school. If they grew up on a Kansas farm, and Mom was sitting at the kitchen table with the calculator, doing all the bills, while Dad was riding a tractor, when they opened up their dental office, they were fine. But if their dad and mom were both employees and went to work 8 to 5, they were at a serious disadvantage. But I can't believe we went way over an hour. I could talk to you for 40 days, 40 nights. Your website is AFFderm.com.
Yeah,
so like AFF is
like affiliated dermatology. So
affiliated
dermatology.com.
So affiliated has 2 F's. So AFF. Derm for dermatology. I'm trying to give you this as a mnemonic device. So it's AFF for affiliated, then derm for dermatology.com.
Absolutely.
They got 6 locations. They're killing it in Ahwatukee. They're in Gilbert, North Scottsdale, Deer Valley, Anthem, Surprise. My final question is, before we started the show, you were telling me that the people in Ahwatukee were 10 times nicer than the people in Gilbert, North Scottsdale, Deer Valley, Anthem, and Surprise. Why do you think that is?
I think that is because they're always smiling. I think it's the dentists in this area.
Touche, that was a good one. Hey, seriously, man, thank you so much.
Absolutely, thanks for having me.
Ryan, thank you, buddy.